One of the things that's been really fascinating about working with large multi-state health systems is the variety of boards of directors across the system. The health systems of today, as you probably know, have really come together in the last 10 to 15 years. In many cases, these diverse multi-state health systems were brought together through a variety of different kinds of mergers, acquisitions, and partnerships over time. And what that means is that the way in which the board responsibilities are laid out is often quite different from board to board across the system. So it's very interesting to engage with large health systems and start to work at board level and realize that the different boards have very different responsibilities, or sometimes they have very similar responsibilities, but there's one thing about one particular board's responsibilities or authorities that is quite different. And one of the things that we've noticed is that management teams are often not paying as close attention to the governance responsibilities because they're focused on the organization's success. And the board members are relying on the management team members to prompt them when they have responsibilities that they should be carrying out that are unique or different about their particular board relative to other boards in the system. This at times has created some challenges for the leadership and the board members, where an organization within a health system, the board will not realize that they had authorities and things will get overlooked, and then they come back to it later and there's conflict or challenges. For instance, one of the large health systems that we worked with, one of their boards had written into the merger agreement when they had first joined the system like 20 years prior that they would have the ability to approve any new CEO hire. The health system had the unfortunate situation where they had to replace the CEO who was running that particular hospital. The executives didn't recall that that had been a feature of the merger agreement. And so they overlooked it and they rather announced to the board that there was a new CEO in place. And the board members that have been there for a long time, of course, corrected them. And there was a little bit of egg on your face that created some additional difficulties on top of the challenges of bringing on a new CEO to begin with. So those are kinds of things that as you look at health system governance, be wary that one board is not one board, and a hospital board may not be the same, have the same responsibilities as another hospital board in the system.